Ventura County boasts a Mediterranean climate and with its close proximity to the Pacific Ocean, encourages a healthy lifestyle. Ventura County is also home to one of the most efficient, visionary healthcare systems in the country.
So where would you go if you were a nurse? When you look at the amazing county that we live in, and it has been ranked by the Washington Post as the #1 county in America for its beauty, where would you go? I say there's no better choice than Ventura County Medical Center.
I wanted to be a nurse because I wanted to help people. I know every time you interview nurses they tell you the same thing, but it's very true. You have to have kindness and compassion.
The reason I became a nurse was because I wanted to do something that genuinely contributed to people in the world, and where I could give the most of me to other people.
I've always wanted to be a nurse since I was a little girl, and I think I was just born with that desire. I really feel it's a real cliche, but it's a calling.
But I feel like this has such a family feel. In this hospital, I was able to have opportunities that I did because of the great relationships that I had with my management.
The best thing about working at Ventura County Medical Center are the relationships that I get to build with my patients, with my coworkers, with administration, just the ability to feel like we can all come together as a group.
I wanted to come to VCMC because I knew it was a teaching hospital, and the reason why I had got into nursing was because I really enjoyed the educational part of it. And that was what really drew me to it.
The education department here at VCMC is always offering something new. We just got a new education director, educational manager, and she's brought in a whole wide array of colleges that we can subscribe to.
We've brought on board a nurse education program which provides at-the-elbow assistance to nurses, which I think is truly in line with our spirit of education in wanting to make sure that not only are we training physicians for the future, we're training nurses for the future, and we're bolstering every single day the care that we provide here at VCMC.
We have every nurse in the hospital in some way or another on continuous education, whether it's the LVN, the RN, the BSN nurse who's here, our managers, our charge nurses. We have courses for everybody.
Ventura County Medical Center is an academic center. There's never a day that you don't learn anything. I like teaching the new grads when they come in, just pouring myself into them, showing them what I learned.
Because VCMC is a teaching hospital, we have residents coming through all the time. The physicians that are on staff here are all used to teaching people, so it is a great learning environment.
The physicians here at VCMC are amazing. They're an amazing group to work with. They're easily approachable. They're absolutely willing to take suggestions on what treatment might work individually for each patient. They realize that we as nurses spend the most time with the patient at the bedside, so we will sometimes have more insight as to what would work better in a certain situation.
Working with the physicians in Ventura County Behavioral Health is a really nice opportunity because you get to really know them. You work with them on a day-to-day basis. We have physicians that are from a varied background, ethnicity, and they're all very delightful to work with, and they all have something to bring to the table.
At Ventura County Medical Center, we have the privilege to truly serve our county by being the only Safetynet hospital in this area. We provide full access to all, including those who otherwise have barriers to care.
It's a Safetynet hospital, but this particular healthcare agency deals with people that don't have other resources, and it deals with educating the population as a whole.
We are a compassionate organization that is very focused on mission.
I work in the emergency room. It's also a great department and a great fit for me because I get to deal with so many different levels across the lifespan. So I could be working 1 minute with a newborn child, and in the next moment I could be working with an elderly patient and anything in between.
One of the other unique things about the healthcare agency in Ventura County is that we have a full spectrum of services. We're not just an acute care hospital. We offer public health nursing. We have a strong mental health footprint.
Public health is it's a broader scope of nursing practice. So rather than just focusing on the health needs of the individual, the nurse focuses on all the needs of the individual. So we look not only at the health, but also the social needs and the emotional needs of the individual and their family.
It's very important to have behavioral health nurses because the nation is really suffering from mental health crises. Ventura County Behavioral Health is one of the best in the state. Everything from housing to therapy to medication support. and it's all inclusive, and I think we're just on the cutting edge of services.
It's been a privilege during the year that I've been here to get to know on a personal level the many nurses that serve the patients here at VCMC and at Santa Paula Hospital. I find them to be the most valuable part of our organization. Their dedication to our mission, their dedication to the community that we serve, and their dedication to what they do every single day.